Okay, so we're going to be talking about doing oral cares for our mechanically ventilated patients with the ET tube. We're going to do these cares every 2 hours to help prevent ventilator-acquired pneumonia in these patients. So you need to knock and introduce yourself. You need to make sure that you wash your hands and apply appropriate PPE, gloves especially. And then we're going to go ahead and begin. So we do these every 2 hours. This is sort of like the handheld part. It controls the suction as far as on and off. The suction tubing will attach to this end right here at -100 to -120. So first thing we're going to do is attach this little catheter. It does have this sort of like shield to kind of help keep it clean. So what we're going to do is, once this is attached to suction, we'll go in, we will examine that ET tube to make sure that it doesn't have any damage, and then we're going to go ahead and suction inside the patient's mouth. So we'll get on each side of the suction, or each side of the ET tube, we'll suction. We want to get any of those fluids that are sitting in the mouth and kind of like pocketing in the mouth. And so that's what we're going to do with this first tool. We're going to suction out those secretions out of the mouth, and we want to make sure that we do cover back up to help prevent any contamination. So then what we're going to do is attach the toothbrush piece, which I do not have, but to use the toothbrush piece, what you're going to do is attach it on top, and then you'll dip it into a toothpaste-like solution. You're going to brush this patient's teeth. So you're going to brush the back teeth, the front teeth. You're going to brush the outside part of the tooth, the inside part of the tooth. So you want to really get all surfaces of the teeth, and you want to make sure that you're getting all the teeth, so as far back all the way around. You want to also make sure you're getting that gum line clean as well. So then once you've done that, you can go ahead and turn the suction on, and you can suck out any of those secretions. And then once you're done with that, you need to use the moisturizer and the swab and moisturize the inside of the mouth, including the cheeks, the tongue, the gum line, and the lips, so that your patient's mouth is nicely moisturized. And then the next 2 hours when we come in, we're going to use our suction catheter. So we'll hook it on here. This is going to allow us to get farther back into the throat where there's those secretions that our patient is not able to cough up because they are intubated. So this is going to reach a little bit farther. You can see that it's significantly longer. Excuse me. You can see that it's significantly longer, so it's going to reach farther back into that patient's mouth and throat and get those secretions that are sitting a little bit more deep into the patient's throat. So you're going to go ahead and get that all suctioned out. Then the next part of the oral care that we'll do in the next 2 hours works very similar to the toothbrush. So you're going to attach this bent swab that has suction. You can kind of see the hole at the end. You're going to dip it into the solution, and again, you're going to clean all the inside surfaces of the mouth with this. You're going to go over the teeth, the gums, the cheeks, the roof of the mouth, all of those inside surfaces of the mouth. And then you're going to go ahead and flip the switch, turn on the suction, and you're going to go back through and you're going to suction that all out again. And then once you've done that cleaning, it's again time to moisturize that patient's mouth. So you're going to moisturize the cheeks, the tongue, the roof of the mouth, the gum line, all of those surfaces. And then you also want to make sure that you moisturize the patient's lips. Anytime you do oral cares, which is about every 2 hours on these patients, you want to be checking that ET tube for any damage, and you also want to be sort of adjusting the ET tube and checking for the patient's skin condition, because we want to make sure that they're not getting any type of sores or breakdown of the skin from that tube. So that would be how you would perform those cares.